Hello, everyone. My name is Dr. Andrew Constantine. I'm a cardiologist and PhD research fellow at the Royal Brompton Hospital in London, the United Kingdom. I'm also part of the Champion Group, which is a UK-based group of experts in congenital heart disease and pulmonary hypertension, focusing on both education and research. And today we'd like to just spend 5 minutes telling you about our cardiac consensus statement, which we've partnered with Down Syndrome International to write for people with Down syndrome. So just why, to start with, why we felt that this was important. Number one is the impact of cardiac disease in people with Down syndrome is quite striking. 40 to 50% of people with Down syndrome are born with heart problems. This equates to more than 100,000 people in the US alone. And 2/3 need treatment and ongoing surveillance. So this is quite a challenge for both healthcare and for individuals and families. The second part of the puzzle is that everyone should have the right to enjoy the highest attainable standard of health without discrimination. And this is what inclusive health means to us. With respect to heart problems, this means that these are diagnosed early without bias or discrimination, and that surveillance and treatments are available when they're required. And finally, we believe that people should be supported to understand their healthcare needs and also to make their own choices whenever possible. So with this in mind, as I say, we partnered with Down Syndrome International, and we formed a group, an international group of experts from around the world, including also people from low and middle income countries, which formed a very important part of this. And that was step 2, and then we had a vote on key areas of focus that we felt were important for this document. We also then consulted with the Down Syndrome International membership for feedback on key areas, and also to make sure that what we were suggesting was relevant to low and middle income countries. We performed a scoping review of the literature, and then we drafted the consensus document with a core group of experts based on their individual expertise. Finally, and this is the step we're at now, after internal validation, internal peer review, we submitted our document for external scientific peer review prior to publication. And as I say, without getting too technical, I just wanted to highlight, we developed 40 best practice statements in 10 key areas. And these are the kind of things that we focused on, which all work together to develop better heart care. One was getting an accurate idea of how many people are actually affected by congenital heart disease in the Down syndrome community. Then to make sure that prenatal screening best practices were clear and were being followed. The optimal timing of repair and the rate of complications was covered. And then the optimal preoperative evaluation was also covered, because this is something where people with Down syndrome may be more susceptible to other health conditions, and these need to be taken into account when planning to deliver safe surgery and repair. This needs to go hand in hand with equality in healthcare delivery, and so this was something that was important to go throughout the project. And along with this was making sure that people who need it get lifelong expert care. Once people reach adulthood, then the transfer to adult services, that transition process needs to be tailored to an individual's needs and health needs. And so we also covered this. And importantly, we made sure that these best practice statements were achievable in low and middle income countries. Finally, and importantly, we did have a statement which was focused on heart research, and particularly including people with Down syndrome in heart research and not excluding them unfairly. So how will this help? Well, we think our cardiac consensus document will inform healthcare professionals who look after people with Down syndrome around the world. We gather all the available evidence on the diagnosis and management of heart conditions in people with Down syndrome in one place. And this is designed, it's not a guideline, but it's designed to inform future guidelines on congenital and acquired heart conditions in people with Down syndrome as well. So thank you very much for listening. You can reach me at constantineah@googlemail.com if you have any questions or want to start communication. I'd be very happy to hear from any of you.